Docs, you're welcome.
Thank you.
Thank you.
Right. You look, lovely. Are you related in any way to Kobna Peku, who used to be with us on Joy years ago?
Yeah.
You are? How?
So I think we are cousins.
You are cousins.
Yeah.
Okay, yeah. He used to do drive time and stuff.
Yeah.
Years back. I think 2002, 2003, thereabouts.
Yeah.
Okay. Right. You're welcome. Rabies. We hear of it. Not enough.
Yeah. Sure.
Yeah. It looks like we're not worried about it. We don't talk about it, and I know there's an ongoing campaign with some, should I say, donor or should I say, donor support, right? So let's get into the business and start with the two of you to educate my listeners. Rabies. Most people relate it to dogs, but let's get specific. What is rabies first and foremost?
Thank you so much for this great opportunity. It's been wonderful coming here, and we want to also say want to also greet all your listeners,
Right.
and we thank them for this opportunity too. So rabies is a viral infection. If I say virus infection, these are pathogens that you cannot even see with your eyes.
Okay.
And a zoonotic, that means that it moves from animals to humans.
Zoonotic, right.
And one key thing about rabies is that this virus, once it comes to an animal or a human being, is targeting the nervous tissues, that's the brain and the spinal cord. And once it does that, one key thing is that it progresses.
Right.
It starts and doesn't go back. And one fearful thing about rabies is that once clinical signs starts, there is no point of return. It's 100% fatal.
Once you are infected
Yeah.
and the clinical signs and symptoms manifest,
Yeah.
right, there's no remission.
No, the person dies.
The person will ultimately die
Yeah.
from rabies.
Yes.
Okay. Having said that, let me just come to you, Anita, Dr. Aguasari. I mean, I'll come back to Emmanuel in a sec. But if it is that fatal, right, why are we not hearing enough or a lot about it? And what is the public health burden of rabies? We know you have lots of things to worry about when it comes to public health. But this sounds serious.
Okay, thank you very much once again for inviting us to do this. It's quite important because, as he said, once a person gets it, there are so many conditions. You can get a flu and recover.
Okay.
The risk of dying from a flu or even from COVID, probably not so much. But when you get rabies, it's like a point of no return. That's
Right.
why it's very
A one-way
important.
ticket.
Exactly. So even though you do not have huge numbers of people getting rabies and dying, it's still very important because as an individual, for example, if my daughter gets rabies and dies from it, that's like 100% loss for me.
Right.
Even though you think that, it's not so relevant, not too many cases are being recorded. So I think the fearful and the public health relevance, it lies with the case fatality rate, which is
Right.
almost 100%.
Okay.
Yes. Why we are not hearing so much about it, I think probably is because the numbers are not overwhelming.
Okay.
So you probably wouldn't record so many cases as compared to your malaria or your hypertension, etc. So probably that's why we don't hear so much about it.
Okay. All right, folks, we're hearing about it now on Joy 99.7 FM. We're talking about rabies prevention. It can be prevented, and the management and control of rabies. If you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. Now, I'm pulling up a screen shot of global prevalence or global burden. And when I look, Ghana is it says an estimated 60,000 people die of rabies, one of the oldest and most terrifying diseases known to man. And a color-coded world map shows that, firstly, rabies is endemic in Ghana, right? Dr. Peku will speak to that in a second. And then I think we are in the region of about 90 to 400 deaths right? Either that or the 20 to 90 range. But let's explain to my listeners. When I say rabies is endemic, what does it mean?
So if we say rabies is endemic, it means that the disease is present with us and has stayed with us for all these years.
Okay.
And
Just like we can say malaria.
Exactly.
Right.
One key thing about rabies is that it's one of the underreported tropical diseases that you can talk about.
Okay.
And because it's underreported, and like Doc said, it actually happens in very marginalized communities where people cannot even afford. Those are the people that mostly die.
Okay.
Because they cannot afford the post-exposure prophylaxis and all that. So most of the time it happens. So in the lay language, we'll say that it's a poor man's disease.
Okay.
And it's one of the key things why we are not even talking about it and all that. So
But in our part of the world, even the rich or the not so poor are not so well educated.
Exactly.
Right? So it may not even be restricted to poor people.
Exactly.
Yeah.
Exactly. One thing is that, so most of the cases, like we said, is mostly dog mediated, because dogs are mostly very close companions who normally carry the virus, because they are the reservoirs and all that. So because one, if you look at our part of the world, the attention that we put in place to take care of our dogs and other pets is very, very low.
Okay.
So in so doing, you have a lot of these cases happening in our communities.
Right.
If you come to my my metropolis, for example, just within this year, we've had more than 5 confirmed cases in dogs.
Right.
And you have a case that one dog probably may actually will actually bite more than about 5 people.
Okay.
So in such cases, if these people are not able to afford this post-exposure prophylaxis and clinical signs starts, these people are actually going to die in a way. So it makes it very, very scary, because we are living with these animals within our community, but little attention is known. Like you're saying, public education, people don't know what disease can cause. And we are also not paying close attention to these things. The public education is very, very low.
Okay.
And because of that, we actually handle them anyhow, and it causes a whole lot of problem.
Okay. Yeah. I'm aware there's an ongoing campaign. We'll emphasize on that, but let's get the basics.
Yeah.
Okay. We've said rabies is viral, it's zoonotic, it can move from animals to human beings, right? And the case fatality is 100%. If you get it and nothing is done, you will die.
Yeah.
All right. But let's come to brass tacks, basics. So what is it? Where does it come from? With COVID, we know we got an understanding after some time. It should have, or it's said to have come from here. Where does rabies come from?
Okay.
Dr. Aguasari.
Okay, thank you. So rabies is endemic, like he said.
Yeah.
And the endemicity is maintained within the dog population.
Okay.
Both the wild and then the domestic. So you find that it's being transmitted from dog to dog. That's what. So when a human being comes into contact with the saliva of the rabid dog, so in saying that means that if you are bitten by a dog who doesn't have rabies, you don't get it.
Okay.
But if the dog does have rabies and then it bites you or scratches you, or maybe even just licks part of your skin that is broken
skin,
so anytime there's a breach in either your mucous membrane, like around your eyes, inside your lips, you know, all those places inside the nose and all that, or just the skin broken from maybe you just went to the kitchen, you got a cut, and then your rabid dog bites you or licks the place, then means there's a breach in the skin, and then the virus can enter into the body. So initially it would go into your muscles. I won't go too deep, but then it doesn't multiply much over there locally, but then it ascends to the central nervous system, and then once it hits the central nervous system,
that's
then
your brain,
the spinal cord to the brain, then there's no return. So where it comes from is basically from mainly the dog population, accounting for about 90 to 99% of all rabies cases.
Right.
But then we have other animals as well, like
Mhm.
other mammals that also carry rabies.
Cats,
So
cows,
even
bats.
exactly
Right.
bats and all that. So
Okay.
even in our, in Accra here, we have bats around.
yeah.
So I think maybe because the canine rabies is
And
what
they're
we
delicacy
hear
for
more.
some.
Yes. So maybe it's even a source of transmission, because some of the
Right.
cases that we get, you usually don't hear of the dog history,
Right.
dog
Okay.
bite history.
Okay.
So mainly from the dogs, but then also from other mammals as
Okay,
well.
great. If you just joined us, it's 22 minutes past the hour of 2. I'm taking a bite into rabies, so to speak, literally, right? We want to understand it, its cause, its signs and symptoms, and then we understand its transmission. We are hearing that it is of serious public health significance, even though comparatively, when we look at other conditions, maybe it may be somewhat eclipsed. There's a program ongoing. There's a program, I think, which is an integral part of the health service and the veterinary services, right? So it's not just that they've just started a program. There's a program for this already. We're talking about it with my guest in the studio, Dr. Emmanuel Peku, Metropolitan Veterinary Officer for TEMA, and Dr. Anita Aguasari is a physician in Kolebu Teaching Hospital. We're looking at these things. Any questions, concerns are welcome on WhatsApp 055 11 11 997, and we're live on Facebook and YouTube. I see Dede in Maryland asking about the vaccine. Oye in Afienya, you're welcoming me to your home, and there's another one. Let me just click on it. I just wanted to do the headlines. Okay, I'll get that. Good morning. Please, I've been listening to your program every Sunday. Dog bite is too rampant in the Volta region, yet the education is low in my region. This is Abochi Philip from Keta. All right, so we'll talk about, the impact of the programs and the education and the awareness. Many thanks for sharing with us. I'll read yours in a second. So coming back, Doc, dog mediated. When we talk of some of these things, then we need a vector. Yeah. Right? A medium for the transmission. Yeah. So we're saying, or Dr. Aguasari is saying, 90% of the cases we see are dog mediated or through dogs, or dog bites and dog saliva, scratches, and so on and so forth. So does that mean that we can neglect or ignore other vectors, other carriers?
Okay, thank you so much. So over the years, like we said, rabies, every mammal is susceptible to rabies.
Okay.
It can be a goat. In my district, for example, I've recorded a case of rabies in a goat.
In a goat?
Yes.
Right.
Because these goats were bitten by... Yes. Ooh. So these goats was bitten by a free roaming dog.
Okay.
And after some few weeks, the ghost started. So we are saying that these mammals are what we termed as the end host. They don't go actively biting people and all that.
Right.
So most of the time when these mammals get it, the people within the immediate vicinity are the people that they normally give the virus to if they are exposed in one way or the other. Okay. So hardly will you see, say, a cattle moving in the street from house to house going to bite people. Okay. But let's also not forget that there are two forms of the disease. We can have the very aggressive form and the very down form. Right. Most of the cases, these mammals have the paralytic form, and they don't go actively biting, but they die quietly.
So the host or the carrier will die.
Yeah.
We may or may not identify that they died of rabies if the systems are not in place. Exactly. Okay. So let me come very quickly to surveillance, and then we'll move to signs and symptoms. Exactly. How are we monitoring this? Because if it's there, we're in an endemic country, an endemic region, right? How do we keep surveillance on rabies before we even get very quickly to signs and symptoms? What's the program like?
Yeah. So if you look at our structure, that is why we are talking about the One Health approach to be able to control rabies. So if you look at the surveillance system, it doesn't rely on only the veterinary units, but it's all encompassing with the One Health partners. Okay. So assuming somebody comes to a health facility and tells you that there's a dog bite and there's an information coming to us, the vet follows up and do an assessment of the dog. We
almost akin to contact tracing.
Exactly.
You must follow up
Yes.
a report.
And
but a report must be made.
Yes.
And you've emphasized this is the most underreported.
Exactly.
Right.
It's underreported one because most of the time after having probably assessed, and if the dog probably is showing signs, you have to probably euthanize the dog or kill the dog and confirm. It's underreported because sometimes you are not getting the needed resources to move these samples to the lab. And two, we have a lot of people that will kill these dogs and then they will not even report to the appropriate authorities.
Okay.
So you have most of these cases happening in our communities whereby we are not able to trace to actually confirm the cases.
Okay.
Most of the time, the cases that come are people that probably people that probably have a care for their animals, or people that probably are bitten in one way or the other.
Okay.
Those are the people, and you have a handful of them coming to the veterinary clinics or the veterinary centers to be able to report these cases.
Okay, 27 minutes past the hour of 2 on Joy 99.7 FM. If you just come aboard, this is Ultimate Health on Joy 99.7 FM with me, Nortey by nature. I'm discussing the prevention, management, and control of rabies, a viral infection, with Dr. Emmanuel Peku. He's from the Veterinary Directorate, and he's the Metropolitan Veterinary Officer for Tema. Next to him is Dr. Anita Ago Asari. She's a physician with the Kolebu Teaching Hospital. Any questions, concerns, experiences are welcome on WhatsApp 055 11 11 997. And we're live on Facebook. And shortly, I will activate the phone line so you can bite them directly. Right. So coming back into the studio. So this is the surveillance framework, right? There must be a report, and there must be a follow-up by the veterinary service or by the health service?
By the veterinary service.
So this report must be made to the veterinary service?
Exactly.
Not to a hospital, not to Kolebu, not
So if the report goes to the hospital,
yeah,
it has to be referred to the vet, where the vet will follow up.
Okay.
Because we know the signs, and then we can be able to identify if the dog is rabies.
So since I have a physician
Yeah.
and a veterinary officer, both of you are doctors. What's the relationship like? Though you look like you're friends. I mean, system-wise, I'm very serious. System-wise and surveillance-wise, how does it work? Are you going to struggle to get the, let's say, Accra Metropolitan Veterinary Officer to report a case and get the follow-up? How does it go, Dr. Abu?
It's not a struggle at all. So the physician who sees...
Talk through.
So the physician who sees, or any clinician who sees, is supposed to alert the patient to ensure that they do report to the veterinary. And also you can, within the municipality or district, you can also give a call to the veterinary officer to come over to help assess the situation.
Okay. And the response is prompt? They're not going to tell you that they need transport, because even police sometimes have challenges. Let's look at it in reality, okay?
Yeah.
Not what should be, but what is. Will they come immediately? Do you let this patient, this index case, do you let them go and hope and pray that they will go to the veterinary services? What happens?
Well, you try to do both, actually. So the patient has to make a report as the veterinary service. So usually what happens is that they would have really washed their wounds and then gone to report the case to the veterinary whilst they are also coming. It's like it happens simultaneously usually, because you have the community members who know that a dog has bitten this person or that. So whilst the family is taking them to the hospital, you have a follow-up of the community members to the vet. So that's what usually happens. So it goes hand in hand. But then if the patient hasn't reported already, then you have to alert them to do so. But then you can also call the veterinary and try to link the patient and the vet. Okay,
I know for programs that have, this stringent surveillance model, is there a central database or something that can map you and say, well, Ridge Hospital reported this number of rabies cases and Tema General and so on and so forth? Is there a central surveillance focus for the information and these referrals and the surveillance program?
Yeah, thank you so much. So that is what the One Health concept is trying to drive at. So the ultimate goal is that we are working towards working together, because if you see the One Health approach, it's a multi-sectorial approach.
The health of our environment, the health
exactly.
of our animals, the health of human beings is all related.
Exactly.
Right.
So we are still in the process of looking at how best we can probably link up these data and all that. In fact, if you look at the One Health approach, if you go to the national level, it works very well, where veterinary shares or the animal health sector shares information with the human health and all that.
But I love it when you talk like this. Look, even with national ID card, banks will tell you they are still photocopying the same thing which they say they have access to and so on. You're telling me that there's this seamless integration within the health sector when it comes to this?
The national level. But when you come to the district level, where the whole show happens, it doesn't click very well.
Right, okay.
Information sharing sometimes is difficult. Difficult in the sense that you may have a physician probably not even referring cases to the vet for the vet to follow up and all that. Okay. So it's still something that we need to work at.
Folks, if you just joined us, 32 minutes past the hour 2 on Joy 99.7 FM. I'm being very pernickety and fussy about the details, because if we are talking about prevention, surveillance is key. We must know what is happening, the magnitude of what is happening, the spread. Somebody just called, sent a message that in Volta region, Charlie Dog by Don't Joke is happening live, right? I saw some data which suggested Ashanti is quite high and a few other things. I'm reluctant or reticent to use them because I haven't fully read the reports, okay? But so in terms of Ghana, very quickly, Dr. Peku, what's the spread looking like? Do we have any nodal or focal or hot points when it comes to rabies that we should be focusing campaigns and interventions on?
Thank you so much. So rabies in Ghana is everywhere.
True.
In fact, I can't single any community in Ghana that doesn't have rabies.
Okay.
And I just want everyone to know
general
that
awareness.
Rabies is so close to any person.
Right.
Because in our communities, there are dogs, there are all these hosts. You never know where a dog will come close to your child or somebody to bite the person. And the key thing that we are saying is that we need to do extra more to vaccinate our dogs.
Okay, great. If you just joined us, we're talking about rabies on Ultimate Health, Joy 99.7 FM. Dede has been typing in Maryland. Dede, welcome. Is there a vaccine for rabies? If vaccinated, is it for life, or does one need to get additional booster shots? And after how many months or years? So what's the routine for vaccination? Can one get rabies from consuming a rabid animal? Or the heat, depending on its intensity from cooking, kills the virus? Dede wants to know. I don't think she's planning to eat a dog, but very relevant questions. Let me just see if I have a couple more. WhatsApp is 055 11 11 997. This one says, also from the US, I want to ask, is the treatment of rabies free? And how is the government tackling the spread of rabies in our community, since few people properly take care of their pets? In the foreign countries, you need a license for your pet and you need to keep up with its vaccination. This is from Herman Amwaku. Oh, it's in it says Dansoman. Okay, but the number is a US number. Okay, right. So he's asking about licensing for pets and then whether the treatment for rabies is free. Can we quickly hit those? And
so when it comes to the treatment of rabies, I think Dr. Asari will talk a little bit about it. But when it comes to the dog vaccines, in fact, now we have a whole lot of NGOs supporting us to embark on free vaccination campaigns and all that. Okay. But ultimately, if you look at the cost of even vaccinating a dog, is very, very cheap in our country. You don't have to spend more than, say, 50 cedis to vaccinate a dog. And it's once every year. Once you vaccinate a dog, it's for a whole year. It's valid for 1 year. Okay. And the dog is protected.
All right. Yeah. What about vaccines for humans?
So the human vaccines, you are supposed to take, if you are bitten by a confirmed rabid dog, you are supposed to take 5 vaccines. That takes a whole month.
Okay.
And
5 vaccines or 5 shots within a month?
5 shots
Okay.
within a month.
All right.
So different doses
Okay.
within a month.
Because you have a confirmed rabies
Exactly.
dog and a bite.
Exactly.
Okay.
So the course is 5 vaccines.
All right.
And these vaccines, as and when it's available in the health centers, you may have it for free, or you may have to go and buy it.
All right. Clarify something for me, Dr. Pickwen, for my listeners.
Yeah.
Vaccine and prevention, right? But here I hear you speaking of a confirmed case,
Yeah.
right? And exposure,
Yeah.
right? And possible or probable infection,
Yeah.
and then vaccination after that.
Yeah.
Right. I want to clarify for my listeners. Is
Okay.
that vaccination? Is that treatment? What is it?
Okay. So we still want to emphatically say that there is no treatment once clinical science starts.
Okay.
But it's 100% also vaccine preventable.
Right.
What do I mean? Timely vaccination. So these vaccines are supposed to be given we have the pre-exposure.
Right.
That is 3 vaccines.
Right. That is preventive.
Preventive.
You haven't been exposed at all.
Exactly. So
Correct. Okay.
somebody like me that I work with animals, I always have to take the 3 vaccines.
Okay.
When I'm bitten by a confirmed dog, I either take 1 or 2 vaccines, extra boosters to protect me.
Okay.
So that is how the course runs.
Okay. Right. So again, we've diverted into vaccines. I'll come back to signs and symptoms. But if you have a dog,
Yeah.
licensed or not, but you go through the required vaccination program or regimen for the dog, right? So I've got a dog or I got a puppy. This is a range of vaccines they're supposed to go through, just like childhood vaccination or immunization. Do I, the owner, since I have a dog, need to take the pre-exposure? As an owner of a dog that has been duly vaccinated, do I need to protect myself further?
So we are always saying that the vaccines are very expensive, especially the human vaccines.
Okay.
So if you're able to do that, there is no need taking the vaccine.
Okay.
However, maybe you are in an endemic country like Ghana. You never know where probably you'll be exposed.
Okay.
That is why one key way of the prevention is preventing dog bites.
Okay.
Going to the territories of dogs whereby probably you can be bitten and all that. So because of how expensive it is, we don't want to encourage every pet owner to go and take the vaccine.
Okay.
Because if we do that, it will result in a state whereby people that duly need it may not even get the vaccine.
Okay, understood. All right, folks, 39 minutes. The clock is ticking. I'm going to activate the phone line. We're talking about vaccine. We're talking about prevention, management, and control of rabies on Ultimate Health, Joy 99.7 FM with me, Nortey by nature. I'm in the studio with Dr. Emmanuel Peku of the Veterinary Services Directorate. Next to him is Dr. Anita Aguasari. She's a physician with the Kolibo Teaching Hospital. The phone line 055 11 997. We can take your questions and concerns. How will I know my dog has it? And then alongside that, I'll swing to Dr. Aguasari and see if we can do treatment or management of dog bites. But how will I know? What are the symptoms I'll see in a dog? Right? And is there an asymptomatic phase which can still be transmissible?
Thank you so much. So one key thing, I just will use this acronym ALPHA to describe the signs and symptoms. Alpha. Yes.
ALPHA.
Exactly.
Alpha.
Yes.
Okay.
So one key thing is that the dog will have a change of behavior. So the A, which is alpha, is aggressiveness.
Aggressiveness.
So
okay.
A dog that probably is very normal or very quiet dog will now tend to be aggressive in the sense that maybe it may bite without provocation.
All right.
When you see that sign, you have to be suspicious.
Right.
2, when you are taking the
aggression, which is out of character.
Exactly.
All right.
So it can be either way.
Some dogs are bad news already.
Exactly.
All right. Okay.
So they are bad news, but this one, in fact, every dog will bite when it's stressed up.
Okay.
It can be either way. You may have a very aggressive dog also becoming very quiet.
Right.
That's a paralytic state. So
let me just quickly take this call and bring you back on track.
Okay.
Hello, good afternoon.
Hello, good afternoon.
Right. Who is this? Is it Bishop?
This is Dr. Che speaking.
Dr. Che, right. Are you a veterinary doctor or is this a Dr. Che I know?
Yes.
Let it be a question, Dr. Che.
In the past, when rabies vaccinations were done yearly, which was general, it means every year the campaign were done, and then the incidence of rabies bites were lower as compared to modern times, when these programs have been ceded to the local government. I mean, local authorities.
Right.
It's making it difficult for the veterinary department of the local government getting funds to do their rabies annual rabies, vaccination.
Right.
And this is where the problem is. When there's allocation of funds for, vaccination of dogs, cats, the monkeys, and the rest in the district, such incidences go lower. But here is the case. I don't think there have been even an allocation for that job. Now we are talking about, rabies to human beings, and then other serious cases which we are observing now. The prevention aspect is more important. So I'm praying that the local government will seed, funds for the veterinary department of their, assemblies to do the vaccinations yearly.
Okay.
And we shall get lower, incidences. But it's not being done now.
Okay.
Now we have to even pay for the vaccination, which is preventing people from taking those type of vaccines. Okay. Right. And it's very serious,
I think the point is well made. Thank you so much, Dr. Che.
My pleasure.
Right.
Bye.
So this whole, he calls it a seeding kind of shift of power and balance and resources to the local government infrastructure impedes and compromises the kind of prevention and management that you can do. Is he on track with that?
Yeah, so I think that
because it's something I asked you earlier.
It's very perfect, and because the key thing is that if we're able to break the transmission cycle, it goes a long way.
And you require resources to do that.
Exactly.
And he's saying that you lack those because the appropriation, the disbursement, and all that is caught up in this local government labyrinth.
Exactly.
And therefore suffocates the program.
It's true. So there should be an allocated funds for when it comes to rabies.
So there isn't?
No.
There is not?
There is not. So as and when an assembly wants to support, they support.
As and when?
Yes.
So that makes absolute nonsense of her emphasis and her awareness campaign, because the whole process can be aborted.
Yeah.
As it were, by a lack of interest, lack of resources at any local government level or platform.
Exactly.
All right, I'll try not to get into that, but it does annoy me, right? But coming back, okay, so he's saying, look, you should have annual programs which are resourced. And he's saying also that these programs are validated in the drop in numbers, right, of cases and so on and so forth. Yeah. And they are validated in sense of their preventive objective.
Yeah.
But we have these challenges strangulating them. Exactly. Just quickly, Dr. Peku, I know there's an ongoing push, right? And it has some support, which maybe somewhat sidesteps these challenges.
Okay.
Right.
So thank you so much. So I don't know if I should still go back to the science.
No, I just want you to talk about the support you have, and then we'll come back.
So now ECOWAS has given us vaccines. So now we have rabies vaccines in the country.
Okay.
Which these vaccines are supposed to be used for national campaign. So these vaccines have been disbursed already in the various municipalities and all that. So I think that in the coming weeks there will be probably announcements in various communities for people to have their dogs being vaccinated for free.
Okay.
However, we always, if you come to my municipality, for example, maybe Pokatamanso, where I do an oversight responsibility, we are doing free vaccinations.
How are you able to do free?
So you have, in our place like this, we have an NGO that is supporting us.
Right.
Mission Rabies is giving us the vaccines for free.
The name again?
Mission Rabies.
Mission Rabies.
Yes.
Okay.
Yes.
It's a local NGO.
No, it's an international NGO that is supporting us.
Right.
Yeah, and you have people like maybe Breakthrough Action also supporting with the sensitization and all that.
What is Breakthrough Action?
It's also an NGO that is also supporting this whole idea.
So these are international NGOs that are supporting.
Yeah.
So Breakthrough Action, I think it's a USAID program.
Yeah, they actually help with the sensitization, printing out flyers and helping.
Breakthrough Action. Okay,
yeah.
we thank them for supporting this program. I'm fast running out of time, but let me come back to signs and symptoms in the dog. We started with alpha, aggression.
Aggression.
Can we run through them quickly?
Lethargic or being lethargic, that's weakness.
Weakness.
The P, normally you have paralysis.
Right.
The H, you have hypersalivation or hydrophobia.
Okay.
And
fear of water.
Exactly.
Okay.
And the A is abnormal vocalization, where you have the dogs or the humans having
the barking is not the same.
Exactly. It changes and all that. So these are, if you see these signs, you should suspect
aggression.
Yes. Aggression, lethargy,
weakness.
Yes.
Paralysis.
Yes.
Okay.
The H hypersalivation, drooling, and all that.
Okay.
And the last A is abnormal vocalization.
Okay. Yeah. Great stuff. I have a caller on the line. Hello. Good afternoon.
Good afternoon, Nortey.
Sorry if I've kept you on the line. Who's this?
Oti Watson from Tema.
Oti, shoot quickly. Shoot your bullets.
Yeah, I'm asking. Formally, we can hear from the van or cars going around that bring your dogs and rabies around. So nowadays they are stopped. Is that any problem? That is why they are stopped. Because normally they always come around and tell us that bring your dogs around. But now they are stopped.
Right. Okay.
So if you see some dogs, nowadays I think some dogs, a lot of dogs don't have no. Formally, you see a dog have some chain or something in its neck. You see this dog have some injection of rabies, something. So if the bird kills your cat, this bird they have some rabies lances on its neck. But nowadays you can't see that. What is the problem?
All right. So he's aware of the program. Should I say recurrent programs? There are information service vans going around announcing bring your dogs for vaccination. He says he doesn't see that anymore. Is that the same local government resource crunch?
Same, yeah.
Okay, right. So we'll see. I try to avoid some of the government officials because when they get on my platform, they are not as assertive as they should be. 030212216541. This one says, hi, Nortey by nature, good job always. Kindly let your resource person assist me with this, okay? I'm currently staying with my in-laws who have a dog strapped at the back of the house, which comes out by itself once in a while and is driven back again. Please let me understand. There are quite a number of us in the house. What are our safety chances in the house? It has never been vaccinated, nor is it licensed. This is Z from Aquitiman. Any comments on that?
So I will entreat him that he should just get to the nearest veterinary clinic, and he should just go to the assembly. In every assembly,
district assembly.
Exactly, the veterinary unit is there. He'll get somebody to do the vaccination for him.
Okie dokie. Right. So, Dr. Che brought this up, and there was a question earlier, I think from Dede. Is the rabies treatment and vaccination, is it free?
Yeah, so like we said, if it's a campaign that is supported in the dogs, it's basically free. But the treatment, there is no treatment.
Okay.
But the prevention, when it comes to a human one, is as and when the vaccines are available.
Right.
And it's accessible.
Okay.
If it's not
what
accessible,
is the current state of availability? I'm sorry, I'm cross-examining you.
Yeah, it's if you go to the health centers, it's basically very, you don't even have it.
It's scarce.
Yes.
Okay.
So
because
you have to go and buy.
I hear when I listen to Zipline, my friends at Zipline, they say, oh, we're flying out some of these snake venom serum and all those kinds of things. You're saying rabies vaccine is scarce.
It's scarce, yes.
Okay. So with what are you running the current campaign?
So it's for the animal sector.
Don't tell me IMF gave us some.
No. So with the animal sector, the vaccines are there so much.
Okay.
They are more than enough.
Right.
But it's only the human one that you may have it.
Okay.
A little bit. But the animal vaccines are are so much in the
Right.
system that
Okay.
I think that no matter how many dogs you have, there is no problem.
Okay.
with
It's looking
vaccine.
like I need to take another bite of this topic. But let me ask you this. I have a vet who comes home, does the dog and all that. And there are many such vets, right?
Yeah.
There are also veterinary, should I say, outlets,
Yeah.
private. Okay. And then there's a public veterinary service.
Yeah.
Okay. How do I know the vaccine is patent, it's good? Am I supposed to check? Am I supposed to look at some dates? Because as soon as you jab my dog, I know we're good to go. Is there any process by which, when you do your yellow card for vaccinations
Yeah.
for travel,
Yeah.
right? I know at entry points, they check the batch number as against, and I see that the vets stick
Yeah.
the batch number in the veterinary card of the dog.
Yeah.
Is that sufficient?
So I would say that you should know who is coming, because there's not everybody that comes to your house that is even a vet.
Okay.
So you should try and get an ID card or an identification that shows that the person is a vet, because you have a
Qualified.
lot of people
Okay.
that move around.
Okay.
Vaccines are supposed to be kept on ice, so we say a cold chain.
All right.
So if somebody comes and probably is pulling something from his bag and injecting
From
as
his backpack.
rabies,
Mm-hmm.
you should know that it's not a vaccine.
Uh-oh.
So we should be
No,
very
say-
careful.
Say that one again.
So if
Somebody comes to your house
and then pull
he
it,
has the vaccine or the injection, right?
Yes.
And then he pulls the vial from his bag.
his bag.
It's not under any cold chain, right? And then he jabs your dog, and then he peels off the thing he's supposed to peel off and puts it into the dog's vaccination card.
Yeah.
Then you need to be
You need to be very careful, because it's supposed to be kept on ice.
okay. Right.
There are different treatment that we do for dogs, not just the vaccine. But if the person is doing a vaccination, and then he doesn't get he's not carrying a flask or anything, and it's just the drug is just in the bag.
Right.
It's not a vaccine.
Especially if he says it's rabies.
Yes.
Okay.
It's not a
Any vaccine for a dog should be
kept on ice.
kept on ice.
And
okay.
it should be in a Coleman box or
All right.
anything that will
Okie
contain
dokie.
ice.
I'm getting this from my brother Sylvester Sigbaya. He says, you said breakthrough action is supporting 4 regions, Ashanti, Western, Greater Accra, and Upper East regions, to establish district-level risk communication subcommittees which will advocate for support for the district assemblies for pet vaccinations and awareness campaign. There's also sensitization campaign in basic schools in these regions. So he's sharing that for our benefit. Thank you very much, Sylvester, a very good brother and friend of the program. So we need to be vigilant even when it comes to the vaccination of the pets. We may seem to be in compliance,
Yeah.
but something may be wrong.
Exactly. So that is why we are saying that go to a government facility where a veterinary clinic
Right.
or office, make sure that you get a qualified officer to vaccinate your dog for you.
All right. I know, Dr. Ago, I've left you out, but I'm going to take a separate bite of you probably next week with your permission.
Yeah.
Okay? I don't bite hard, but only on Sundays. Right? But coming back to you, Doc. So a rabies dog,
Yeah.
confirmed. What do you do with that dog? Are you going to pump him with vaccines, or what do you do with a rabies dog confirmed?
Thank you. So before we confirm, once we see the signs are alpha in a dog,
Right.
we don't wait. We quickly have to humanely kill that particular dog,
Oh, dear.
because the only way we can confirm is to get the brain of that particular dog and test.
Okay.
So
You will actually do a post-mortem on the dog?
Yeah, so we actually do a series of tests. We do a molecular test. We do an antigen test to confirm whether it's rabies or
At your
not.
cost?
So we have we have the veterinary lab,
Right.
which is resourced to be able to do that for
Okay.
us.
Okay.
So samples are taken to the lab for confirmation.
But it's a one-way ticket for that dog.
Yes. One way to
You're not coming back home.
no.
Oh, dear.
You have to do that to confirm, to protect other dogs, in the sense that once it's positive, we have to take an action and go around and do a mass vaccination.
Okay, let me hit you.
within the-
Right, let me hit you again for the benefit of my listeners. So Dede asked, can you get it from consuming the meat of a rabid animal, in this case dog, right? If it's cooked and whatever, is it the virus still active?
Very well. So if you look at the transmission, the virus is actually released mostly through the saliva.
Okay.
So if you have somebody butchering the dog or any animal that is rabid, the possibility of the person getting is when probably the person come in contact with the contaminated probably brain or other tissues. But once the meat goes to the fire and is being cooked, the virus denatures. But we have people that have gotten rabies through preparing the meat. And so that is where the risk is. But it's when the meat is cooked, the virus is denatured. But the risk of contaminating yourself is very high when you are preparing.
Right. We got work to do on this. Ultimate Health is not going to let this go. I know there's also on the radar currently an anthrax outbreak. We'll have to look at that in separate installments. But Doc Aguasari, just before we leave, I mean, so are the symptoms or what? Let's say I've been exposed as a human being. Will I change?
Yes.
I will.
Yes, you will.
Would I be subject to the same alpha?
Yes, similarly.
Wow.
So, like we said from the beginning, once the virus hits the central nervous system, then the symptoms start. So initially, you may have a pain or tingling or itching at the site where the bite is. But for dog-mediated rabies, this is not frequently found. It's the bat-mediated that you find the most of the time.
Okay.
And then initially, your flu-like symptoms would start around that same time.
Right.
And within the next, where you have the next step, where you have the mad in quote symptoms, that's when you have your aggression, agitation, restlessness for the human being. Exactly. They also have the hydrophobia and also aerophobia because it causes spasms of their muscles, which causes pain. Okay. So from that time, then they progress to the coma, where they die from either cardiac arrest or respiratory arrest. So you do change. That's the classical occurring in about 80% of the cases.
Wow.
But in 20%, you may have just a paralytic. I think he also alluded to that in the animals, where the human being is just lethargic. It's also in the alpha paralytic, and then it would also progress eventually to respiratory arrest and then die. So you either change in one of these two ways.
Wow. So I'm looking at your face and I'm hoping that you say that for the human being, it's not a one-way ticket. But from what you're describing, once there's an onset of these clinical milestones, if I can call them benchmark milestones, then really there's not much we can do. Is that the case for the human being?
So there have been some cases of people who've had rabies and have recovered, but these have been bat-mediated cases, not the canine. So yes, I think I came across some literature that has sized the 100% down to 99.99% case fatality rates because of these bat-mediated survival cases. But for our settings here, I don't think we've seen a rabies case confirmed that has survived. So we are still almost 100%.
Whoa.
Once you get it.
Whoa. We try to dissect the issues and go drill deep down. But sometimes our findings are alarming, right? I'm hoping that you've been informed and transformed by this information. I will definitely, no fail. Even if there's football, Abeko and I will fight so that we don't cancel the program. Apologies for last week. There was a football match, Black Stars match. But this is something I want to pursue, right? To go down into the clinical management, right? Into control. So once you have a case, for example, in Tema, you said you had one somewhere, and you had one in a goat. What happens to the people of that area, the animals or dogs in that area? Are you going to check them? What do you have to do, right? Or is it just critical to isolate that nodal case and then consider it done? These are further questions that I need to ask. But again, I just want you, as we part, Dr. Peku, to hit on reporting. Where do you report? What are you required to produce? Okay? And must it be indicated or premised on a bite? If I have a dog, there's alpha, there hasn't been a bite. I can still make a report. Can you just quickly hit those and then we wrap up?
Yes, thank you so much. So once you have a bite, the first thing that we are saying, before even you go and report, make sure that the site is washed with running water not less than 15 minutes. And then you quickly go to the nearest health center, go to a hospital. Please don't go to any pharmacy to go and get any painkiller or something. It will end you up somewhere.
Okay.
But go to the nearest hospital, and as we are establishing the protocol, once you report the case is assessed, and if they have to start the post-exposure prophylaxis, they start.
Right.
And then you quickly get to the nearest veterinary clinic and report the case, and they have to go and assess the case, and possibly we do a quarantine for a period of 10 to 14 days. Within this period, if the dog is rabid, it will show.
All right.
Yeah, and then we also give a report back to the health facility.
Okay.
Yeah, from there, if the dog is alive after 14 days and they've even started the post-exposure prophylaxis, they stop on the third dose because the dog is negative.
Okay.
That one we can say the extra 2 vaccines for someone who may urgently need a vaccine.
So your hope is that when all this is done, your dog turns out to be negative.
Yeah,
Then there are other outcomes.
exactly.
Right. The dog may still be ill,
Yeah.
but it's not rabies.
Exactly.
Okie dokie.
Yeah. So when the dog is negative, we have to look at other things that probably may be causing the whole problem.
Wow.
Yeah.
Right. So you need your own contact tracing team and all that. Do you really have that?
So it's there in every district. We have staff, veterinary staff there.
Okay.
Though probably the numbers are still not enough.
Okay.
But at least we have a couple of staff that follow up
Okay.
to do this case investigation and still report back. And we have referral sheets and all that we also use to report these cases back
All right.
to the health centers and all that.
Great stuff. Thank you so much. Sylvester is literally screaming at me, bite prevention. Right? Of course, if the A happens and the dog is aggressive, uncharacteristically aggressive, then the chances of a bite happening is high, and then the chances of transmission, right, through the open wound, saliva, all that is high. So bite prevention is key. And we'll look at some of the education and stuff next week. Okay, I've granted you two programs for us to look at this and bite hard on this. I'm reluctant and reticent to pull in the district assembly or the local government, but I'll do some cage rattling and saber rattling over the week to see if I can get a sense of what this is. And I think Dr. Che is a vet I know, right, who lived on my road. But we'll get some of these perspectives and see what we can do on that. Once again, many thanks, Dr. Emmanuel, is it Kwao Peku, right, of the Veterinary Services Directorate. He's the Metropolitan Veterinary Officer for Tema. And next to him, Dr. Anita Ago Asari is a public health physician, and she's with the Kolibu Teaching Hospital. Next week, we'll focus on what we see in the actual cases, and then look at the different types of prophylaxis, the vaccination, etc. Make sure you have not only merely passively been informed, be transformed, right? If you have a dog and you're not looking after it well, this is a message to you as well, right? It could be possible that your dog has picked this up and you are not aware. Many thanks to my producer, Abekusa Kofi, for production, and of course to you, my discerning listeners, for being with us every Sunday afternoon. You make my day every Sunday afternoon. In fact, it extends to the night as well. Many thanks to you. Stick and stay on Joy 99.7 FM.